Good to see you today. Everybody survived last night's storm and the blustery winds this morning. Glad that you're here. And we're very glad to have you at our annual Sentinel Initiative Public Workshop. I'm Mark McClellan. I'm the director of the Engelberg Center for Healthcare Reform. We have been supporting this workshop now for its 5th year, and today's agenda highlights a lot of progress made in the Sentinel Initiative, as well as some new opportunities for the initiative's future progress as a public health tool. The Sentinel Initiative, as many of you know, arose out of the passage of the Food and Drug Administration Amendments Act of 2007, the FDAAA, and this law mandated that the Food and Drug Administration develop a system for post-market risk identification and analysis using existing and emerging electronic data. This system was intended to complement, to add to the tools that the agency had already developed, including its existing spontaneous adverse event reporting system, AIRS. 5 years ago, when we held the first of these meetings, the goal was to bring together the stakeholders who could contribute to this effort in terms of data, in terms of insights, in terms of analysis, in terms of communication dissemination, in terms of all of these different perspectives to discuss, really to start the discussion about how this system could and should be developed. The Sentinel Initiative's pilot project, Sentinel, which followed those early meetings, is now currently in its 4th year. And Sentinel has grown up a lot. It uses electronic healthcare data, including administrative claims, and increasingly electronic clinical data to conduct active surveillance. The initiative's distributed database consists of a growing number of data partners and a growing number of individual covered lives. I think the last numbers that had been officially released prior to today were around 126 million individuals. You'll hear some new numbers, I think, a little bit later this morning. The distributed model underlying Sentinel, meaning much of the data, the individual level data, stays at home with the participating partner organization, means that the data partners continue to have the operational control, the physical control over their data within their existing HIPAA-compliant environments. And this approach, among other things, helps to promote the protection of patient-level information behind firewalls. It permits each partner organization to analyze the data and to bring insights that they have from their unique familiarity with the unique characteristics of their own data systems. You're going to hear later today about several examples illustrating how the Sentinel system can be a valuable resource for monitoring regulated medical products. And we're also going to hear more about how Sentinel's contributions can extend beyond medical product safety. The insights from this type of distributed approach, which now is up and running on a very large scale in this country, perhaps have applications elsewhere. These tools, the infrastructure developed over the last few years, may be able to support evidence development in other areas, which in turn can be a critical part of a learning, evidence-based healthcare system. Now, the utility of a robust system for post-market evidence not only is relevant to medical product safety, but it can also facilitate and support timely access to innovative products in the market too, and we'll hear some more about those applications as well. This timeline highlights some of the issues related to Sentinel. Sentinel has surpassed the data goals in its pilots. The FDAAA had a goal of exceeding 100 million patients by July 2012. And as I mentioned, by that point, there were 126 million covered lives in the Sentinel program. And it's accomplished these goals through those highly competitive partnerships. Are you guys fixing the slides right? Thumbs up. Okay, so here we are in timeline. The public-private partnerships that have made up Sentinel and the Sentinel effort include not only those Sentinel collaborations that I mentioned, but also the Observational Medical Outcomes Partnership. OMOP has supported the development of active surveillance methods and getting more clear insights from the analyses using these large observational data sets through development development of methods and through development of techniques to improve and gain insights about the properties of data models and systems in these healthcare databases. The early years of the Sentinel Initiative were dedicated toward building the infrastructure and methodology for conducting active surveillance. More recently, however, many Sentinel investigators have also conducted a number of actual analyses, including the latest assessment, which, for example, examined a suspected association between certain antihypertensive medications and angioedema events. We're going to see some more specifics of that assessment on one of the presentations later this morning. This past year also marked the enactment of the Food and Drug Administration Safety and Innovation Act, FDASIA. FDASIA is an important piece of legislation which provides FDA with stable and consistent funding through fiscal year 2017, at least as much as that's possible through 5-year legislation. And this revenue, which includes revenue collected through industry-driven user fees, helps to maintain a predictable and efficient review process for the drug and biologic products that FDA reviews. It's an important complement to the direct appropriations for the agency. When these laws get passed every 5 years, they're often accompanied by a number of directions, goals set out by Congress for things that it wants FDA to do in conjunction with continuing its user fee support. And among the law's requirements this time, FDASIA directed FDA to extend the Sentinel system to approved medical devices to make it more comprehensive, and to engage stakeholders for discussion on current and emerging Sentinel projects. There's some of that activity already ongoing, as we've mentioned, with these the work of many Sentinel meetings like this over the last 5 years. There's a clear congressional intent to have more of that, to have this be as interactive a stakeholder engagement set of initiatives as possible. And so meetings like this annual workshop have been important before. I think they're even more important now as Sentinel is really starting to come of age in order to provide an interactive dialogue between FDA and various of the stakeholder communities. And so your participation here is really important. I guess I can't quite say it's congressionally mandated, but it's pretty close to it. This initiative is not going to work well. It hasn't worked. The main reason it's worked over the last few years is because of this kind of large-scale public-private collaboration, and that's going to be even more important as Sentinel takes its next steps in the years ahead. There are going to be a number of opportunities as we go through the day for participation from all of you, and so we encourage that. And if you do have any questions or comments above and beyond these many opportunities, I hope you'll ask me, some of our staff here, some of the many FDA staff who are here to follow up as well. So here's an overview for the day. We're going to open with a keynote address from Dr. Janet Woodcock, the Director of the Center for Drug Evaluation and Research at FDA. Dr. Woodcock is going to provide an overview of the ongoing progress and the future directions of the Sentinel Initiative. We're then going to hear from Dr. Richard Platt, who is going to provide an overview of the current state of many Sentinel activities. As you'll hear from Rich, many Sentinel has been very busy. We are then going to have a short break. After that, we're going to highlight a few selected mini-Sentinel protocol-driven evaluations. This session is intended to provide some insights into the ability of mini-Sentinel to investigate potential safety signals, as well as the types of questions that mini-Sentinel is capable of investigating. We thought this would be a good way to spend the time to see, for you all to see a little bit more up close, the kinds of analyses that are taking place now on an ongoing basis using this infrastructure. The next session after that is going to discuss collaboration between OMOP, the big effort around methods research that is ongoing, and many Sentinel investigators, which has helped to support the advancement of active surveillance research, and hopefully will continue to support our ability to conduct these analyses as effectively as possible and reach the right conclusions, effective conclusions from the analyses that are done. Then there's going to be a break for lunch. And then we're going to switch gears and focus on the future of the Sentinel Initiative. When we reconvene, we're going to start with a discussion on innovative new methods for providing timely information about new medical products through prospective surveillance programs. Next, the panel will discuss opportunities to expand the public health impact of the Sentinel Initiative and what steps are underway to build a platform for broader evidence development. And then the final session of the day, a very important one, will explore Mini-Sentinel as a tool for evaluating drug safety issues that require regulatory actions. Our speakers on this panel will once again feature Dr. Woodcock, along with Dr. Karen Midthen, the director of the Center for Biologics Evaluation and Research. And then our stakeholder panel will kick off a conversation for extended Q&A feedback. And this is very important, the stakeholder feedback at the end. It's the last part of the day, but it's also very important to make sure that FDA and all of us are hearing from all of you about what you think of the Sentinel Initiative activities so far, what your suggestions are for improvements, where should Sentinel go for the future. And I hope you'll start thinking now about some contributions that you could make at that very important final part of the meeting. We're very much looking forward to your thoughtful questions and comments. Before we get started, just a few other housekeeping and administrative items. Just as a reminder, press have been invited. This workshop is being video recorded. Everything that people say here today is on the record. For those of you who are panelists today in the audience, please keep in mind that our timekeeper, Jonathan Berard, Jonathan, right here in front. Can you wave again? Make sure everybody sees you. Jonathan will be reminding you when you're approaching the end of your allotted time, so please pay attention to Jonathan. Also, please be sure to turn on your microphone up here on the podium before speaking. As I mentioned before, we've got a number of opportunities for comments and questions built into the agenda today. When we get to those points, you will have an opportunity to ask questions. As you can see, there's some microphones set up on the floor in the paths across the room, and I hope you'll use those opportunities during the course of the day. So that's an overview for the day. I would now like to get us going with our opening keynote address from Dr. Janet Woodcock, the director of CEDAR. Janet, I think, is known to everyone here, and so I'm not going to spend a lot of time. I'm not going to spend any time on introduction. I'm just going to let you all hear from her. Janet, come on up.